somebody said it was swollen.
Good morning, it's Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live from the Dolph Simons Family Studio. Glad to be back with you this wonderful Tuesday morning. I am joined, of course, by Hawkeye. How
Hi.
you doing this morning, Hawk?
It's good. It's great scooter weather out.
Scooter weather. Well, you better wear a helmet, brother.
I got my helmet.
Okay, good man. All right, so we're also joined by Joe Reardon, President and CEO of the Greater Kansas City Chamber of Commerce, and a good friend to all of Kansas City, Wyandotte County included. He is back with us for a call to action for the community following the recent update with chief medical officers and community leaders before Labor Day weekend and broadcast on the Monday of Labor Day right here from our studio. So first, Hawkeye, how's the county going this morning?
Doing pretty good. You know, we talk about fluctuations. We want to keep our fluctuations low, but we know that there will be some. Today, we have 22 patients, 6 in the ICU, but only 1 on the vent. However, we do have, again, still 5 people who are in that recovery period after the acute illness who are still on the ventilator. So we know, and we've talked about how long people can stay on the ventilator. We are seeing that. We have 35 patients otherwise in the hospital who are here because of COVID initially and are still in the hospital, but are not counted in our acute numbers.
First in the acute numbers. So that gives us 55 beds currently occupied by COVID patients, COVID or COVID-related patients. So that's still a really large number of patients that are being here because of that. And remembering that in early March, we didn't have anybody here because of COVID. And so that's almost 2 units full of COVID patients. That's a lot. That's a real lot. Yeah. And as we've been pointing out, we don't really use our semi-private rooms as semi-privates anymore, the private rooms. We may have to rethink that as we head into the flu and the cold season this year. But if you think that 45 beds plus 55, that's 100 beds impacted by COVID in a census. And today our census is 750 or thereabouts.
Yeah.
So, wow, that's a big number, right?
That's
a really big number. So, well, Joe, welcome to our program this morning. It's a delight to see you again, to have you here. How are things going?
Good, very good. The weather is beautiful outside, no doubt about it.
Beautiful.
Yeah.
So talk to us a little bit about how do you think the community has received the CMO meeting with community leaders last week, and how's that been received, and just how are things going with COVID in the business community in general?
Yeah, it was, it was a little less than 2 weeks ago when we did the live event with the CMOs. And in the world of COVID, 2 weeks feels like, 2 months maybe. So it wasn't that long ago that we held the live stream with the CMOs from the region. And you all did such an amazing job coordinating that. But the response has been overwhelming and very positive. We had 400 people on the direct live stream, and then several hundreds more that were on YouTube Live and other media outlets that streamed this. And I think one of the interesting things is that we've posted the entire event on our YouTube channel at kcchamber.com. There's a link to it. We've had over 5,000 views. And I just was, I think the feedback I've heard, and myself personally, to hear from CMOs throughout the region that are really on the front lines of this and talking in a very personal way about what they've seen and experienced was an impact like no other. And I think it recommitted so many in Kansas City to the idea that, this sits with us. It's part of this is our personal responsibility to wear a mask, to social distance, to wash your hands thoroughly and frequently. Those things matter, and they can make a difference, and they affect people's lives. And to have that message come through in such a personal way in that event, I think really had an impact on Kansas City business in our region at large.
Well, I'll tell you, I thought we really enjoyed doing it, and it needs to be done again by gosh, just call. So how are the businesses out there doing? How are people, do you think, surviving COVID?
Well, first, before I say that, Dr. Stites, you're like a natural at this, so I think you've got broadcast in your future. There's no doubt about it. You did a great job.
If I don't drive Jill crazy, I think I really specialize in that. That's what I'm a natural at, driving Jill crazy.
But you did a great job with a lot of moving pieces with our CMO event. But I think really what we're seeing from businesses is across the spectrum still a lot of concern and a lot of caution. And unfortunately for many of our small businesses, a lot of them shuttering. All you have to do is read the headlines, either in the paper or online, and almost on a daily basis, you can read the real struggles that business have. And are experiencing. And one of the things that we wanted to get across in the CMO event and that we're out there doing every single day is to save if you're pro-business, and I think we all are in Kansas City, we want to support business. We want to support our local business. And if you really want to do that, the best thing you can do is wear a mask and socially distance and be cautious. Go out and do what you need to do and support those businesses, but do it in a way that's safe for you and for others. And if you do that, we're hopeful that the rate of infection will lower and the incidents that you're dealing with will reduce. And that's the surest way to keep business open and functioning in Kansas City. And by the way, the other critical and important part, which we talked about during that event, is to get back to some sense of normalcy with school. And with the infection rate that we have going on right now, as you all, the experts, have said, to be able to do that effectively, to have normalcy is just not, we're not there yet. And when you have that fluctuation in how school works, that directly affects what's going on in business. We have businesses across the region that are telling us they're concerned because they're having to offer flex time or part-time or off time to parents that are doing all they can to make sure that their kids get what they need and want to be working full-time but just can't right now. So the surest way for us to support business is really to support lowering the infection rate so we can get back to some sense of normalcy with school, which is so important to kids and families.
Yeah, I think that's perfectly right, and that, you know, we're a business too, and we feel that when parents can't come in because their kids are at home or are having to do online learning and things like that, it impacts our ability to staff a clinic or the operating room or anything else, just as it does, I think, all the other businesses in our community. Now, you know, we have a large enough pool of people we can usually we're able to find folks, but still, that's a struggle, and I think for a small business it can be really impactful, and you know, I like to shop local and buy local as opposed to chain. That's just, you know, I enjoy getting to have those personal relationships. So it kind of hurts your heart when you see these businesses close that you've been going to for a number of years and you've developed personal relationships with people. You just want to have them pull through, and we can do it. You know, you can shop safely. I think that's the other part of the story is you can shop safely. I go to the grocery store every week, and you know, I think I shop safely. And if I got to go get my clothes mended or go to the cleaners or whatever, you can shop safely. I go to K&K Fly Fishers over on in Lenexa, and you know, I can go fly fish shopping safely. And I think it's all about the ability to wear a mask and be respectful of the other people that are in that store, so that you can maintain that distance. And by doing that, you keep everybody else healthy, the businesses stay open, and our community stays open. And I think that's just incredibly important. So we so appreciate all the great work you guys are doing.
Yeah, and let me say that, you know, I think the business owners that are part of our chamber, we have about 2,000 members. They care about their employees. They want to keep their employees safe, and they want to keep their employees working. And the best thing we can do to support that is to wear a mask and be cautious. And that protects the employees of that business that are out there every day doing what they need to do to make a living, and an employer that's wanting to do all they can to stay open and provide that opportunity to their employees. But we want it to be safe as we can be. And that really speaks to all of us. It means we all have to make a personal commitment to this. And I think it's the most supportive thing you can do for standing up our local businesses is to wear a mask and be safe when you're out there shopping and interacting with a retail-facing business. That's what we can do to bring Kansas City back to where we want to be. That's what we can do as a rallying cry for all of this region, to stand up and say we're supporting one another in business here, and we're doing it every day.
Yeah, you know, I think that's absolutely true. And we know, Dana, from an infection control standpoint, that this is not a Republican or a Democratic thing. This is the American thing to do to keep people safe so Main Street stays open. It's if you want to flaunt the rules is when Main Street's going to get in trouble and close again. And it's amazing to me we can't see it for what it is. We want to fight about other things when the reality is we've known here in the hospital how to keep people safe for generations. This is not new news. Right. That's the part that just kills me. It's not new news, right? You know, when you go in the hospital, people wear a mask. They go to the operating room, they wear a mask. You go to an infection control room, they wear a mask. Why do we do that? So we can keep each other safe. And that's the story we're in right now here in the midst of COVID.
Yeah, you know, we still have people who, like you said, want to skirt the issue of the mask and doing the right thing. It is, if you want to take the science out of it, the medicine out of it, the economics of it is so important. And if you want to keep families working and food on the table and keep employers employing people so that they can have income and do all this, that is important to continue to maintain these public health guidance pillars, the distancing, the masking, so that the economy can get back to where it was and people can stay employed and we can keep people at work and keep these businesses running as well.
Yeah, and we've just got to remember to love our masks, right? We want to have this big thing, I hate my mask, but we're trying to get that 50 ways to love your mask.
Right.
I mean, I could come up with a few right now. I cut myself shaving. I need to pick my nose, but I can't. I got bad breath. My nose hairs need to be trimmed. Oh, man, I got a little zit right here. I didn't brush my teeth this morning.
No.
My lipstick's off a little bit. I got nose blush on. My face is running. My face sags. I could hide all that with my mask on. I got a little sunburn. I could go on for hours for 50 reasons to love your mask. And most of the thing you got to do, you should love your mask because you love each other. That's how you take care of each other, Joe.
But I did want to mention one of the things that the Chamber's very much focused on currently is thinking about what more we can do to get to a place where we have a robust economy again. We're an organization that advocates for policy changes across both Kansas and Missouri. And sometimes we have good success. We were on board with the campaign to expand Medicaid in Missouri, and we were glad to see that got passed, and we continue to advocate for that in Kansas as well. Sometimes we're not as successful. At the very beginning of this, we advocated for the Missouri governor to do a stay-at-home order throughout the state to make it uniform, and we didn't get all the way there. But right now, we're advocating for adoption and funding of the Mid-America Regional Council. This is a big title. Regional Public Health Action Agenda for Regional Capacities for Testing and Tracing, mouthful. But essentially what it means is a coordinated effort across the region for testing and tracing that's sustained over time so that we can control the spread of the virus in a coordinated way. So we're not involved in the delivery of that. It's public health with the Mid-America Regional Council. But we certainly are advocating for our counties throughout the region to consider allocating some CARES Act funding to this regional strategy and coordination, because the virus just doesn't know borders. It knows no borders. It knows no political jurisdictions. And the more we can do to be sophisticated about understanding where it is and reducing the spread, we believe that sets us on a path for economic recovery next year that will be really critical for all of us in Kansas City.
Yeah, I totally think, and we said that the other day, that the virus doesn't read a roadmap, and it's not a superhero. We know we could do the superhero video sometime again. Everybody's just aching to see us jump up and down a little bit more. No, I think that's right. The virus doesn't respect, it can't read a roadmap, and so it doesn't care about the darn state line. It doesn't care about what party you're in. It doesn't care if you're not in a party. Well, actually, it does care if you're in a party, especially if you're in one of those kind of parties where on Mass Street we saw at the KU video from last week.
That's bad.
It does like those parties because it's going to party with you. All right, let's see if there's questions from media this morning, Jill. Not hearing any, so we're going to go to our listening audience.
Yeah, Donna has a question. She wants to know, beyond or in addition to the mask wearing, what could the Chamber of Commerce do to somehow highlight the local businesses that are trying to stay open, that are at risk of closing, and what more could the public do? Is there a list?
Well, Joe, that's like the softball lob right over the plate to you, man. It's right there. It's in your strike zone.
Right. I would, go to our website, kcchamber.com. You can see all that we're doing and get a sense of our business members, and we're highlighting some of them on our social media as well. We want you to go out and support local business. We want you to do it in a safe way, and that's what our members want as well. And so our local website has all kinds of information relative to what's going on with business during this time of COVID. It's nice that you guys have a couple of the pages up there. But we'd love to share with you some of the stories that we have out there relative to small businesses and reopening plans and what's going on. And it's a wealth of resources. And a lot of times we connect you to other places. And we have a place where small businesses can share their story so that we can get it out in social media and other ways so that people understand what's going on right there around the corner from where you live. So I'm so glad that there are so many in Kansas City that want to support local and small business. It's the heartbeat of our community. We have great large businesses that have been here for a long time. But if you think about those, we could name those. all of those businesses that are major employers in Kansas City, almost to a one, are ones that started as small businesses right here in Kansas City and grew up here. And so when we support small business, even in the time of COVID, we're really supporting the spectrum of what's going on in Kansas City and how our economy develops. So go to our website. We'd love to hear from stories from small businesses, and we're sharing them as well.
That's so true about Hallmark cards and how that started and grew up right here in Kansas City, and look at where they are today, or Cerner, or some of these other big things. I go down Pinstripes or Peters or now or Hudson and Jane and buy some clothes or whatever, trying to put them on my uniform every day, or I like to go down to Foo's Frozen Custard there in Brookside, or over to the Prairie Village. There's a great hardware store over in Prairie Village Shops, and just both sides of the state line. There's some wonderful food to be eaten over in Wyandotte County, and I'd like to find some of those places, because folks like, oh, what's in Wyandotte? Well, there's a lot of great food over in Wyandotte County, and all these places, Rosedale Barbecue, they sell the best French fries. There are such great places to go to, and these are all small businesses. We so want to support them, because that's just really important to our lifeblood, I think.
Ponax margaritas.
Ponax margaritas. Oh, man, you guys are making me hungry. I haven't had breakfast.
Yeah.
I got to go to clinic. Somebody's got to feed me.
Stephen wants to know, are the Chamber of Commerce's working and consulting with other government officials? He says that there's a commissioner reportedly in Johnson County that is launching a campaign to end the mask mandate. He wants to know, are people talking to each other?
Ending the mask mandate. You know what that's going to do? That's going to end our ability to keep businesses open, Joe.
That just seems backward.
Yeah.
It's backward.
We're constantly talking to elected and administrative officials across the region, and there are also great local chambers that are having these conversations throughout the region. But relative to Johnson County, we were actively encouraging the commission to support the mask mandate when it did pass. So we continue those dialogues on an ongoing basis, literally on a daily basis, having those kinds of conversations. And as I said earlier, we're now talking to local counties about perhaps putting some of their CARES Act money into the regional strategy around testing and tracing that Mark, the Mid-America Regional Council, is leading. So those dialogues are ongoing. They're so very important. Those relationships matter. So we've been having conversations with local electeds throughout the region long before COVID, because you got to have the right relationships when that moment in time comes and the critical decisions are having to be made. And we're very respectful of the hard decisions that local officials are having to make. They're not easy. They're not always as evident as it appears relative to all the pressure that's coming at them. Having sat in their chair, I know that it can be a tough and challenging place, and they need to hear from folks like the chamber saying this is the right course of action to take, and we're going to stand behind you when you take that action. What they need to hear from all of us that believe that, quite frankly. That's very helpful to our elected officials to hear that, and it's part of what we were trying to do with the CMO event as well, is just share that information in a non-political way and let our elected officials and others know that this is the right course of action, and we need to do it together, and we're going to stand together when we do that.
Yeah, I think it's funny because people get so frustrated about the idea about mask wearing, even though it's really temporary. And I think the key to look at it is that it's freedom with responsibility, right? You want to go catch a building on fire. Well, no, you can't do that. I want to go drive 100 miles an hour down a street crowded with school children. Well, no, you can't do that. I want to be able to throw a smoke bomb into a building. No, you really can't do that. I want to walk naked into a building. Well, no, you really can't do that. This is no different. Not really. It's new. I get that, and maybe you don't like having to wear a mask, but the reality is there are things we do to keep each other safe every single day. You can't run a red light. You see, well, you can, but you may have an accident and kill somebody. We say, no, you can't do that. And that's kind of what the mask is. It's to protect the virus from spreading. The weather's going to turn cold, right? I said this last week. It didn't get quite cold enough. But as it gets chillier, and I think by the end of this week it's supposed to get into the 40s again, go outside, take a deep breath, and blow it out. And watch and see how far your breath goes. Then put a mask on and see how far it goes. This is a great thing for you to challenge yourself at home. And you're going to see your breath cloud comes to a screeching halt when you have a mask on. And where does all the virus go? It goes into the mask. So this is not a hard idea. It's just keeping each other safe so our businesses can stay open and people can have a job and have an income. And it's really that simple. Until we have vaccination and effective therapy, the virus is with us. We know how to cope with it. We know how to keep each other safe. And we want you to stay as sheltered as you can, but you can still go out and do stuff. I'm coming to work every single day. I come to work almost every day here. I go out and do stuff. And what do? I wear a darn mask. You can do this safely. And that's what's going to keep our community safe and keep us actually a little more social. You can be more social if you wear a darn mask.
That's exactly the point I was going to make, Dr.
Yeah.
Stites. You know, I think COVID's taught me personally, I think for many of us that, boy, we are wired to be social beings, you know, so this, you know, isolating ourselves and being at a distance, it's tough. And it's not our natural instinct by any means. But the best way we can be social is to wear that mask, even though it doesn't feel like it. That's the best way we can be social right now and still have some kind of connectivity. And I think that's so very important. The other thing I want to mention, which we'll be starting, we've actually started this campaign, is to encourage employees throughout the region to get a flu shot. It's, as you just said, it's flu season is almost upon us. Maybe it is upon us. You'll tell me in a second. But we know there's a lot of employers and businesses, ourselves included, that normally offer flu shots on site. And that's not going to be the case in many locations this year. So, but it's easy to get a flu shot. And we're going to be encouraging businesses and employees to get everybody a flu shot one way or the other starting now. So it's very important.
Yeah, I think that's right, Dana. Flu shots.
Yes, definitely needed. We need to get them every year. Everybody 6 months and above should be getting influenza vaccination.
And flu, is it in the community yet?
There is not any real significant activity of influenza in the activity at this point.
Which is a good
in the
time to
United
go get the
States,
flu shot then.
and specifically in our community, in our region. So,
Yeah.
So I think some private places are offering them. At the health system right now, we are not offering. We are getting our shipments in. We are going to be rolling out our screening questionnaires and then flu vaccination, I think, in about a week. So
Yep, it starts next week.
Yep.
Yep.
We're
There you
ramping
go.
it up.
Jill?
Well, it's a good follow-up question to Cheryl, who says that her KU doc told her that because we were a state hospital, that's why we were not giving flu shots until October. So we have a couple of things you could clarify. One,
No, that's
why are
not
we waiting
accurate.
until October?
Here's
And-
why. It's pretty straightforward. A, there's no flu in the community. B, we haven't gotten the flu vaccine yet. I think we're starting to get it in now, but that's true for most health hospitals. We're pretty much in line with that.
Yeah.
And third, if you wait till the end of September, early October, especially early October, to get your flu shot, you probably don't need to get two
Yeah.
for the flu season. If you get it really early, you probably have to get a flu shot again in February sometime, Dana.
Yeah, we know that immunity wanes after influenza vaccine at about 6 months, so that's why we say about the October period is probably pretty good. That will continue to give you your immunity through to the end of the influenza season. As of right now, in general, there are no boosters recommended. Obviously, for some special populations, providers may be giving them. So we do want that immunity to last for that 6 months through to the end of influenza season. Because recently what we've seen, for the most part for the past few years, is that there is more of a surge at the end part of the influenza season. I think 1 or 2 years ago we did have an initial surge early, meaning November, December, but usually it's going to be later in that February,
it's at
March.
January, February, March. It's always a little challenging. And just to say, I don't know where that thing about we're a state hospital and therefore we don't get the flu shot comes from, but that would be wrong. We're a public authority, so we are an agency of the state, but we are actually independent and with a board of directors who are appointed by the governor. That's our connection back to the state. And so we receive zero state funding in the hospital. Now, the medical school and the university does. They get state dollars to help support the mission of education and research, but the hospital itself does not get any state support any longer. That ended in 1998.
Right, good clarification. Susan wants to know your thought. She said, it's widely reported that there is no research that shows masks actually work.
Oh, boy.
Yeah,
She
Okay.
also wonders about
That's not
that when
true.
it gets cold, that she's also heard that that'll kill the virus.
yeah.
Well, just remember that influenza thrives and other coronavirus thrives during the cold season, which typically is the winter, so it's not
Yeah.
going to kill the virus. And masks don't work. Dana, I don't even know where to start.
This is really concerning, and this goes back to Joe's initial comments. just everything. I think on September 15th, 2020, that's today, right? September 15th, that's
That's
the day?
15th, yep, all day.
It is.
If we
All
are
day.
still thinking that that masks don't work and there's no research, validated, peer-reviewed research that shows that masking and physical distancing work, you are either just aloof of everything, or you're choosing not to believe that for your own reasons, whether that's political or social or economic. That's where you're at right now. There is overwhelming evidence about masks working individually. We've talked about the individual cases in Springfield, Missouri, just to name one, but also other cases in daycare centers where the adults were wearing masks that shows that spread of that disease is significantly decreased. So that's individually.
Just the operating room. If you don't wear a mask, man,
operating
people
room.
get sick.
Right.
It's just.
But there's also population data showing that there is a decreased spread of the disease with masks. There is decreased hospitalizations, and most importantly, decreased death rates with the use of masks. So at this point in time, where we are in the pandemic, if you are not wanting to wear a mask, if you are not endorsing the mask use individually or for a business or for a community, you either really don't understand the science that is there, and there's a lot of it out there, or you are just choosing not to for your own personal reasons, which is not the most healthy or community conscious reasons that there are. So.
Yeah, there are not words to describe why somebody would still think that not wearing a mask is okay, because it is just not okay, and it is just not science. And the problem is, if you were the only one getting sick by not wearing a mask, okay, so be it. That's your choice. The problem is that you're making everybody else sick. That's the problem, see?
Yes.
That's the social contract we have. That's the social contract for responsibility. That is not a socialism. That's not Republican. That's not Democrat. That's healthcare. And it is the deal. Again, if not wearing a mask just made you sick, Godspeed, make your choice. The problem is that not wearing a mask makes all of us sick. That's the dilemma. That's driving 100 miles an hour down a crowded street full of school kids.
Joan wants to know how testing of our employees is going, COVID testing.
Yeah, we test our folks for symptoms for a lot of reasons. What we know is that our overall testing positivity rate's less than what we think is in the community, and that we have fewer cases as a proportion of the population here than we do in the community. And when we look at our cases of our staff who are positive, what we know is that it looks like it's always community spread. We can identify their contact. There are a few times like, well, could that have happened in the hospital? But it is vanishingly small, and for that,
Yeah,
from that
absolutely.
standpoint.
And we just had a meeting yesterday in one of our group meetings, and Amanda Gartner, who we've had on the show, who's the director.
She'll be back on Friday.
Infection
Yes.
prevention, reiterated, because there were concerns that, there is hospital spread from patients to providers. We deep dive into all of those cases of our health employees. And again, so far, as you said, there's been some questions, but going back and deep diving, investigating, talking with the people, the healthcare workers that have been investigated because they are positive, it really does go back to the community for most all of these.
And Joe, I have to say that I think by and large, most people are getting the message. Because I think about going out in Kansas City in June and going to a business, and a lot of people aren't wearing masks, including the people, the proprietors of the business. Now when I go in, I think there's a lot better mask wearing going on than there was. Still a little doubtful about being at Home Depot over the weekend. But the rest of the places, especially the small businesses, I'm seeing pretty good responsibility for wearing masks.
Yeah, I agree. I mean, I think it is catching on, and I had the same experience over the weekend too, being out and about. And it's also a thing where we follow one another. I think it's just instinct. So the more that we're all wearing masks, the more likelihood that other people will comply, because we want to be joiners. We want to do the right thing, and so I think we're starting to see that catch on. And when it kind of catches on, it really can generate some momentum behind it. So I think that's very encouraging. And I once again want to thank you both for doing this every single day. I know it's a lot of work to put together this program, and I want to thank you also for the CMO event. I can tell you, from a lifelong Kansas City, and to see medical professionals that in normal times are competitive. We have an imperative competitive environment. To see all of them, all of you coordinating, cooperating, and telling those stories, you are the front line for all of us relative to our healthcare when something is not right with us. And it just felt good. It felt like Kansas City. And I hope that spirit continues out into the community and that we can all sort of hear that personal testimony from CMOs and internalize that and make a commitment, a really straightforward one, to social distance, wear a mask, wash your hands frequently, get ready to get the flu shot coming up. Those are the things that are going to make Kansas City great going forward. And we can do that. We can all do that together.
Yeah, BKC. That's what we used to say in the early days of this program, BKC. And Joe, I think you're a native. I'm a native. I mean, I was born and raised here. You know, went to Truman High School in Independence, Missouri, and went to William Jewell College in Liberty. I mean, this is my town, and I think it's your town as well. And you know, we care deeply, right? We care deeply. I don't know where Hawkeye's from. Some weird planet, but
Nobody knows.
Catch the Kansas City spirit and hold it in close to you. It's alive in all of us, and we just need to act on it.
Yep, BKC.
This is episode 126.
Episode 126.
Wow.
We've been saying it. We found 126 different ways to say it, to wear a mask.
Yeah. That's a lot.
Final question, because you have to go.
But I got to go to clinic. Yep.
Yeah. All right. Melody wants to know, if this is an easy one, does spraying Lysol after visitors have been in her home, does that work or help?
All right, Hawkeye, that's yours.
I don't think there's any detriment to doing that. Again,
So do you do that?
I don't have any visitors. I have my kids,
your
so
kids?
actually I use everything. I come in, I need everything because I have essentially almost 2 teenagers. So yeah.
Yeah, good luck on that one.
But in general, yeah, doing normal cleaning processes is not going to hurt anything. We know that typical cleaning products that we use in the household can kill the virus. So I think doing that is going to be, it's a good thing to do. It is not going to be harmful at all, so you can continue doing that. Doing your practices for cleaning whenever you have visitors is fine.
Yeah, there you go. I think it's fine. I don't know if it's a requirement
I don't think it's a
anymore,
requirement,
yeah,
but just
it's
keeping a clean household, you know, obviously cleaning off surfaces, washing them.
No, you can't come to my house.
And a normal. Right.
All right. Joe Reardon, final thoughts from today.
Again, just thank you, and to everyone in Kansas City. Let's stay safe together, but let's get out there and support our small business and business in general. And we can do that together if we rise up to the occasion. And I think we're getting there. So thanks to everyone for taking this seriously and doing the right thing. And thanks to both of you as well.
And Joe, you're an icon for us here in Kansas City. Thank you so much for all the great work you and the Chamber are doing. Let us know what we can do to help you, and we'll get you back on here soon. Hawk?
Yeah, I mean, to Joe's point, doing the right thing. We know that masks, there is overwhelming majority of the publications and research that do show that wearing a mask decreases the rate of spread, decreases hospitalizations, and decreases death, both on the individual level and the population level. I am not aware of any references or publications that say wearing a mask actually not wearing a mask actually improves your health and protects you from COVID. So all of the publications say that wearing the mask.
True. Yeah, I think
Correct.
There you go.
So wearing the mask is what's going to protect us. We know that that has a positive effect on decreasing the spread, decreasing hospitalizations, and decreasing death. And if you're not, believing that, if you're not subscribing to that, you are not dealing in today's reality for one reason or another. But it's never too late to do the right thing. Go look at the research. Talk to your friends, talk to who you need to talk to. The masking does help and will protect people moving forward.
Well said. Hey, tomorrow, KU Chancellor Dr. Doug Girod comes back on our program. We're always happy to have Dr. Girod back with us. He's going to update us about COVID-19 on the campus. Chris Wilson, VP of Systems Integration and Innovation, will also be joining. Chris has done a lot of work trying to help us stand up the right thing in the KU campus, which I think is doing a great job and one of the best jobs nationally. Of course, I'm a little biased. And they're also going to talk a little bit about how they're going to start showing how we're tracking the virus there. Don't forget about our 50 reasons to love your mask. In fact, I got a couple of new ones for you just to think about. I tried to rattle off a few earlier. Don't copy my reasons. The one would be able to put your favorite thing you can do because you're wearing a mask. So I love to go to Brookside Poultry. I can only do that because I got a mask on. or Gates Barbecue, because I love it. Because I got a mask on. So you can put your favorite cool thing that can help us understand what you love to do with small businesses in the community about one of the reasons you love your mask. So keep those ideas coming. Hey, here's a part of the 23-member team that helped work the 7 first aid stations at Arrowhead Station during the season kickoff. Yes, they look a little like Star Trek red shirts, but they did survive. Despite fewer fans in the stands, the new isolation area meant the need for more help. The mask mandate and social distancing was strong. Our team was strong. Yeah. They had the force with them. In this case, of course, I'm making a Star Trek reference, which will not surprise anybody that listens to our program. And our next photo, Charlotte and her son Ahmed spent time on the Tomahawk Creek Trail. Note their Star Trek masks. That's the best. Don't you shake your head, no, man. His favorite is Star Trek: The Next Generation mask. It's gold because Data is his favorite character. Data is a cool character. His second favorite character is Commander Hutchinson. His favorite episodes are The Neutral Zone, Fistful of Data, Starship Mine, and Rascals. He wants to know our favorite episodes. Hey, let me tell you, I just love Star Trek, all forms, all sizes. I've been watching Star Trek Lower Decks, a cartoon version right now. It's hilarious and a great show. And Star Trek Discovery starts again October 15th in my household. That's become a national holiday. Well done. And there are so many things I love about that show. The optimism, the hope, the science, the future. You know what? We can share in all those things too. And we can share in those things by doing the right things today. Remember, wearing a mask is not a sign of protest or acceptance. It's a sign that you want to say to everybody else that I love you, that I want to take care of you. Because that's what we do when we wear a mask, is we take care of each other. It's not a political statement. It's a statement of a common bond that we all share between each other by taking care of each other every day, just as we do with 1,000 other things when we try to take care of people. So let's try and do that. Let's try and even do it better. That way we can all say, live long and prosper. We'll see you tomorrow.